Let me add my welcome to all of you. For those who don't know me, I'm Dr. Rick Foster with the South Carolina Hospital Association. And I will tell you, it's very humbling and awe-inspiring to look out on all of you and this audience that's here today on the fourth year of our Patient Safety Symposium. It's just amazing what all of us and what you have accomplished as leaders in our state in improving health care. And I think we've been on this transformational journey and we have so much farther to go. Before we get into the program, I have to mention there was a comment about the fact that the Star Wars opening must have been my thought, and I want to give credit to Margie Boland, our communications person, although there was one part of it that we nixed very quickly, and that's where she wanted me to come out in the Darth Vader uniform. And I said, I want to be Obi-Wan Kenobi. I want the robe and the lightsaber. So we decided just to go with the music. So it's wonderful to be here with you. I want to tell you a little bit more about myself. I have lived in South Carolina my entire life, and I've been very fortunate to have grown up in a very small community, Prosperity. I'm very fortunate that my mother, who is here today, with many other people, have shaped who I am and the way I approach issues and concerns and the way I'm able to, hopefully, as you see it, work well with others to create change. And I've just entered my 31st year as a physician working in the South Carolina healthcare system. And I can honestly say to all of you, standing here right now, this is my proudest moment as a physician and healthcare professional in the state, to realize how much we have accomplished together and how far we have come on this journey, but also to have a chance to reflect on the fact that we have so much further to go together as we work to transform not just the healthcare, but the health in our state, and doing it from community to community. When I joined the South Carolina Hospital Association in this role 4 years ago, I realized very early on that this was an opportunity to enter the mission phase of my career and to treat what I was doing as basically from a mission standpoint to transform health and health care. And it's been driven by three very important people in my life. The first is my wife, Lisa, and the other two are my grandchildren, Nico and Lucas. And let me assure you, 4- and 5-year-old children can re-energize you on a daily basis or overwhelm you. The joy and the enthusiasm for life, even at sometimes 1 o'clock in the morning, is an amazing thing. And I want to start with my wife. For over 20 years, she has gallantly and courageously battled against a devastating and evil disease called multiple sclerosis. And I look to her as kind of as a hero because I complain when I get just a twinge of pain someplace, and she constantly deals with pain and numbness and limiting ability for mobility. And what I've realized as I've watched her fight and her touching within the healthcare system is that while she'll never be able to return fully to full physical health, she'll always be challenged with the physical health. Her emotional and mental health could be much better if we could find a better healthcare system to work with her. The system is so fragmented that it creates a great deal of challenge for her. There's no one really that has been identified as coordinating her care other than doing the best she can and what I can do to help. She's on multiple medications, both for the multiple sclerosis as well as medications to treat the condition she's gotten from the treatment for her multiple sclerosis. And yet she continues to fight that fight. And what I hope for is that we'll reach a day when she and many others that have these types of chronic illnesses, sometimes no matter what they did or didn't do, will be in a system where the care is coordinated and we can actually work to improve the quality of life. And I'm certain that everyone in this room has someone that you know. It may be yourself, it may be a family member, it may be a neighbor or a fellow church member or someone you've treated that is facing the devastating effects from a chronic illness or some other major health challenge where every day you say, we could be doing better. We could be doing better for them and for their families. And we're very fortunate that my wife has a good family support system, and when she has very good doctors and other healthcare professionals, it just could be better. And then for my two grandchildren, Nico and Lucas, they're very fortunate that their mother, my daughter, works for an employer where she does have healthcare coverage. And they do have access to a primary care home. And they are able to go to good schools. But that could change in an instant. Her job could go away, and she would no longer have coverage for them and be challenged with whether they'd be eligible to go in the Medicaid system, what would happen? And they have friends, other children, who don't have that benefit and don't have the access to care and to coverage and miss school on a regular basis because they may be in the emergency room with an asthma attack. And it makes me think that it can be better. And I want them to grow up in a world where our health is better in this state, and they know that the health system will be there to support them. And we do face many challenges in our state. We're faced with major economic crises, and we have major problems with health status and health disparities. It's unacceptable that we have communities where there's a fourfold difference between African Americans and whites as far as the number of ED visits and hospitalizations for asthma. It does not have to be that way. We can do better. And where I have hope, and it's based on all the work that all of you and others that are not in this room today have been doing, is that coming together in a sense of collaboration and collegiality, that we actually can change the system. And we've already seen evidence of that. And I will tell you, when I came to the Hospital Association 4 years ago, if someone had walked up to me and said, in 4 years from this time, we will have a heart attack care system that's one of the best in the country, and that we have reduced the time from door to balloon by over 30 minutes across the entire state, and we're improving not just the mortality rate for heart attack patients, but the quality of life, so they're actually able to play with their grandchildren like my grandchildren, I'd say, that's a wonderful dream, and let me offer you some medications that will help with that problem. And if they had told me that we would have already statewide reduced the infection rates in our hospitals by over 30%, or that we would be the first state to fully commit to using the surgical safety checklist and a team approach to surgical care in every operating room for every surgical patient, I'd say you definitely need more medication. But those have already been accomplished. And it would not have happened if we had not been willing to come together in a spirit of collaboration and a can-do attitude to say we can make a difference. So there is hope that we can do much better to create a healthy South Carolina. And what we're talking about is not only improving the care experience for each patient, and we still have some room to go on that journey, but actually each of you, as not just leaders in your hospitals or organizations you represent, but hopefully leaders in your communities, to create what would be healthy communities, healthy at all levels, where people feel safe to be out on the streets, where they feel like that they know that they'll have access to a primary care home. That when they come in the health system, not only do they get good care at that point, but there'll be someone or groups of professionals working together to coordinate the care across the care continuum. So now it's time for us to work together to build that and to create the triple aim in a way that actually happens, community by community. So over the next several years, we can all come back into this room and say, we've actually not just improved health care, but we're producing good health. And we're creating a healthy South Carolina. So as we move forward today in this session, you're going to get a chance to hear about what I would say is a different approach in health care to making this happen. Building on the collaborative work we're already doing is how do we come together truly across all sectors of the community for the individuals and organizations coming together for a common cause. And in this case, our cause is to create healthy communities and produce health across our entire state. And using the organizing model, and you're going to hear more about that during the course of this session this morning. And I think it's a wonderful way for us to really make that difference, community by community. But I want to finish up with my part of the story by taking back to December of 2009. I had the opportunity to go to the IHI National Forum, and along with over 6,000 other people, walked into the conference room that's probably about 15 times the size of this room. So over 6,000 people for one of the keynote presentations. And I noticed on the schedule there was this gentleman named Dr. Marshall Ganz, and I'll be very honest with you, I did not know who he was. I just knew that he was one of the speakers that Don and Maureen had chosen to come and speak, and they've done a wonderful job of bringing speakers from other industries and other perspectives. And within the first few minutes of his presentation, talking about his story and how we could use the organizing model to create real change in health and healthcare, I found myself on the edge of the seat. It was hard for me to stay in the seat. And I thought about the fact that this is the mentor I never knew I had. And I also realized that a lot of the work we were already doing to improve heart attack care and prevent infections and make surgical care safer was a form of organizing, but it was a way for us to take that to the next level. So that has been a wonderful impetus for us to try to look at how we go beyond just looking at healthcare, but looking at health. And we've had this wonderful opportunity, based on the work that Marshall and Kate and Terry and others have done with the Organizing for Health program, to be one of 2 lead states in making this happen. So as we move through the rest of the program this morning, it's my pleasure to introduce Dr. Marshall Ganz. Unfortunately, he couldn't be with us in person. My understanding he's over in the Middle East, trying to help them with a few social and societal problems they have there. We had a talk the other day, and I said, it may not be that much worse over there than it is here in some cases, but we understand why you need to be there. But he's going to be joining us by video now, and I hope you will have an appreciation for the power of his story and how this model for change, this organizing model for change, can allow us to truly create a healthy South Carolina for everyone, not just my wife and my 2 grandchildren, but everybody else you know that can have a healthier life. So now, Dr. Marshall Ganz.
Good morning. Thanks to Rick and to members of the association and to you all for the opportunity to reflect with you a bit this morning on the challenges of deep reform in the way in which we practice healthcare and care for one another. I've been asked to say a bit about community organizing and what it could contribute to the challenges that you face. So let me say a little bit about community organizing first. What is it? Where does it come from? What's it about? Some locate the origins of organizing in faith traditions. In fact, it's been said that movement that was organized in Egypt not a few weeks ago, but 3,200 years ago, that's recounted in the story of the Exodus, might be one of the first examples of organizing that we have, of people joining together to work collectively to improve their conditions of life and make a new future for themselves on behalf of serving a great purpose. Others locate the origins of organizing in a civic tradition, perhaps starting with the Greeks in Athens and the whole idea that we can govern ourselves, which of course came up through the Protestant Reformation into this country as a critical founding piece of our own story as a nation. Some people locate organizing in popular efforts of people just getting together to try to take care of themselves, like farmers have for many years in the history of our country, workers in labor unions, or like we saw in Egypt recently, young people getting together. Whatever the source, the origins, it's a form of working together that's been central to our own history in the United States in particular. You know, when the French aristocrat Alexis de Tocqueville came here in the 1830s to study American democracy, he was very impressed with what he found. He was very worried about the problem of individualism, because coming from France, where the revolution had created an all-powerful state and lots of isolated individuals, he was concerned about who was going to lift up the common interest, who was going to speak for the whole. So he was worried about that, and he came to this country and he found a rich culture of civic associations, of people joining with one another on behalf of common purposes. And he wrote about that, what he found, and used the phrase, in a democracy, he said, knowledge of how to combine is the mother of all forms of knowledge. On it depends all others. That's quite a claim to make. His point is that in a democracy, it's not only the protection of individual liberties that matter, but also the creation of collective capacity. What he thought was so important about civic associations was that first, they brought individuals together in a way that they could learn from one another and find out and learn what their common interests were so they could act on them together. Secondly, it was important, they were important because in a democracy, being able to count more voices matters. And thirdly, because they were voluntary associations, it meant that people weren't coerced into participating, and they weren't fired if they didn't participate, but they had to choose to commit to participating, which meant that they were crucibles for rekindling the values of our democracy through the participation. Now, my own introduction to organizing came in the 1960s when, after growing up in Bakersfield, California, where my father was a rabbi, my mother a teacher, and I'm sure that's where I get some of the stories that I bring to this. I was completing my third year at Harvard when I volunteered for the Mississippi Summer Project, and I went to Mississippi as part of the Freedom Summer movement of 1964, and that's really where I got introduced to organizing. And I came to understand that organizing was a critical way people could make change. We knew, for example, that that unless the people who were suffering from the inequality themselves became authors of the change in that inequality, it wouldn't be real. It wouldn't last. We learned that underneath problems of equality and inequality and fragmentation, you have to ask the question, well, why is it this way? And you often find that some people are benefiting even as others are losing, which means there's resistance to change. And so unless those who have been losing find ways to join together and combine their resources, just like the people in the Montgomery bus boycott did in 1955 and 6, when they learned that bus fare added together could become a powerful, an important source of power to change the policies of that bus company, unless people join together in those ways, things just won't change. On the other hand, if they are authors of that change, they change not only outside, but also inside. And that takes organizing, and it takes skilled leadership to do. After I was introduced to this work in the civil rights movement, I then went back to California, where I grew up, perhaps tired of being an outside agitator, and went to work with Cesar Chavez for the next 16 years organizing farm workers in California. And we learned the same lessons about the importance of power, of collective action, and of leadership in making it work. After another 10 years of union issue and electoral organizing, mostly in the West, I came back to school. So many of us involved in activism spend all our time acting. We forget about reflecting on what we're doing, and I found that I was starved for that. And so in 1991, I came back, finished my senior year, graduated class of 64-92, came to the Kennedy School to do a master's and then a PhD, and now I teach here. And by the way, my 81-year-old mother got to come to my graduation in 1992, finally happy that her son had become a college graduate. Well, it's never too late. So that's how I came to be doing this work. And I've been privileged to have this opportunity not only to reflect on what I've been doing, but to work with a rising generation to make it understandable. In fact, every morning, every time I go to class, it feels a little bit like having an opportunity to have a conversation with the future. And it's in that way that I've had an opportunity to think through some of the challenges in organizing and put them together in this way. So I'm just going to take a few minutes to share that with you. And then, of course, you're going to be hearing from Kate and Terry and Rick and others who will be engaging you in the question of how and whether organizing tools can help you in your mission. First of all, organizing is based on the idea of seeing people not as clients for services, dependent on services, not as customers purchasing products, but rather as constituents, that is, as citizens. And the word constituency comes from the Latin. It means constare, which means to stand together. And so the idea is bringing people together to commit their resources and then to choose how to use those resources on their own behalf. So organizers work with constituents, not with clients and not with customers. Now that requires a certain kind of leadership. And so the understanding of leadership that we have is that it's about accepting responsibility for enabling others to achieve purpose under conditions of uncertainty. Now let me go back over that. First, it starts, of course, with responsibility. And then it's about enabling others. Leadership's not about being a diva or a shining star in the universe illuminating everyone with its brilliance. It's about engaging with other people in, third thing, purposeful action. And finally, under conditions of uncertainty. And it's the conditions of uncertainty that make it so challenging, because that means there's a challenge to the head, to the hands, and to the heart. To the hands, there's the challenge of, how do I get the skills I need to deal with this new challenge? To the head, it's the challenge of how do I use my resources in strategic ways to accomplish my purposes. And the challenge to the heart is how can I find the courage, the faithfulness, the persistence, the empathy, the confidence to engage with these risks and deal with them creatively and purposefully. Now, so the way we approach leadership and organizing then is that it's about not only about exercising one's own leadership, but developing the leadership of others, building community around that leadership, and building power from the resources of that community. There are 5 core practices on which we focus. The first is relationship building, because that's the foundation around of creating common interests and commitments. Second is storytelling, because that's how we bring the values that we share alive, so that we're building from a common values foundation. Thirdly is structuring. That is putting those relationships and those values to work in a way in which we work with each other. Fourthly is strategizing. That is turning what we have, our resources, into what we need to get what we want. And finally is action. Translating all of our desires, all of our strategy and great ideas into concrete, specific actions that happen or don't happen, that can be counted, that can be learned from, and that can be built upon. Now, there's 2 other key elements in how we use these 5 practices. The first is based on Stephen Jay Gould's idea that there are 2 ways to look at time. Time as a cycle, which is the rhythm of continuity, and time as an arrow, which is the rhythm of change. We organize time as an arrow, which means we begin to build a foundation, gather the resources we need, build toward a peak, and then with more resources are able to build to a second peak, and then with more to a third peak until we achieve our purpose. In other words, it's not about sitting around and waiting for a grant so that we have all the money we need and all the resources we need before we ever get started. It's about getting started, because that becomes the foundation for generating the resources and the understanding that we need in order to accomplish our purpose. And finally, it's about an idea of leadership that's cascaded, or sometimes we call it the snowflake. The idea is that once upon a time we thought that the way to get things done was to create big, powerful command and control organizations in which some boss way on top figured everything out and told everybody else what to do. Well, that worked to accomplish certain purposes, but it was a big cost. People lost their creativity, they lost their commitment, and these organizations became like dinosaurs. They couldn't change. So there's a different way to approach organization, which is instead of trying to get people to comply, it's to generate commitment. But generating commitment requires the exercise of leadership at all levels, starting at the bottom and building right up to the top. And it's that idea of leaders developing other leaders that is core to what the power of organizing is. All right, I think I've probably gone over my time already, but I just want to wrap up with a reflection with you on just how critical your calling and your mission is. Walter Brueggemann, the Protestant theologian, wrote in a book called The Prophetic Imagination about what he thought was at the source of prophetic vision. He said it was about 2 things coming together. On the one hand, it was about criticality, that is, a clear eye of the world's pain, of its suffering, and of its limitations. But at the same time, he said, it was also about hope, about a sense of the world's possibilities, of the world's joys, and of what the world could be. Prophetic imagination, he says, occurs at the intersection of the 2, pain and hope. Think about what it is that you do. As healers, you encounter the world's pain daily, and you have to become sources of hope. I hope that we can contribute to becoming a source of hope for you in the critical work that you have to do ahead. Thank you very much.
My name's Kate Hilton. I work with Marshall at the Leading Change Project at the Hauser Center for Nonprofit Organizations at Harvard University, and I'm also the director of Organizing for Health. I'm going to tell you a little bit about Organizing for Health and also our partners in Rethink Health, just to sort of ground you in what it is this project is about. But before I do that, I'm going to also tell you a little bit about myself and my own calling to organizing in health. I'm originally from Madison, Wisconsin. My mom was a Missouri farm girl. She grew up to become a Franciscan nun and worked at a hospital run by the nuns in Madison, Wisconsin, where she met my dad, who was a general surgeon. He was born in 1926. He grew up in the Great Depression, and he was a pharmacy mate at a naval hospital in World War II. He was the 11th doctor on staff at the Dean Clinic that grew to 500 during his career. And when he retired, he and my mom, who was later then a hospice nurse, co-chaired a capital campaign for $10 million to build the first Madison Hospice Care Center in our community. And he would go from provider to get providers on board with the effort. And he would say, hospice care is about you. Hospice care is about me. It's about all of us. We're all going to die. We're all going to get sick. There's going to be a point in our life where we're not healthy. So I believe that that statement applies to our health. Our health is about you. It's about me. It's about all of us. When I was a law student, I had an undiagnosed disease. I had so much severe pain from inflammation of my gums, of my joints, of my skin, that I was bedridden. My mom had to help bathe me and clothe me. I couldn't go to class. And through visiting my doctors, they prescribed a drug called Enbrel, which potentially was going to transform my life back into a productive law student, except that my student health insurance didn't cover it, and it cost $2,000 a month, and I was putting myself through law school. So I did what any good organizer would do. I had worked with Marshall when I was a divinity school student at Harvard, and I recruited a team of law students, my parents, my law professor who taught contracts, a judge that I had interned with, and I asked them to work with me to put pressure on my insurer at the university to cover Enbrel as part of my plan. That's what I paid insurance for. Not only did we put pressure on them to cover me, we put pressure on them to cover every student under this plan that needed Enbrel. Because again, health is not just about you and me, it's about all of us. So I'm here because I know from a patient standpoint that if you build a team around you to achieve a shared purpose based on shared values, it can transform lives because it transformed mine. And I know that we in this room know what my dad said about hospice applies to health, that it is about all of us. We know, as Maureen stated in her opening address, that we're spending 2 times as much than any other country in the world per capita on cost, and we still don't have the safest system. We know that our system is fragmented. We know that we can do better on infant mortality rates. We can do better on children's health. We can do better on life expectancy. We can build healthier communities. We can lower obesity. We can lower stroke rates right here in South Carolina. And we know we have a choice. Maureen presented us with that choice to create, to innovate, and to work together to develop a new system and a new design for what health means. Part of this is what Marshall discussed. It requires the development of leaders to lead together in a different way. Leadership doesn't just happen out there, it happens in here. And leadership for change, the change doesn't just happen out there, it happens in here inside of ourselves. So organizing for health is one effort under an umbrella of efforts, not just in South Carolina, but across this country, focused on achieving the triple aim. It's an action research project, and it is focusing on work with patients and their families, churches, teachers, our communities, as well as providers and payers and employers, all of us to come to the table to work together to look at our system and imagine what health and well-being should really be for ourselves. As Marshall discussed, organizing provides a system of how to get there. We can imagine what the solutions are. Maureen confronted us with some of those this morning. We have examples from Sweden. We have examples from Grand Junction, examples right here in South Carolina with the South Carolina Partnership for Health, and McLeod Hospital's work on utilizing the checklist. We have ideas in our own communities and our own hospitals and organizations of what we're striving for, and we know what we have to do, and the question is, how will we do it? Some theories of change are effective working from the top down. Organizing offers a theory of change that works at all levels, including the bottom up. And so before I talk a little bit more about organizing, since Marshall did a really good job introducing the concept of organizing, I just want to share with you, how did we even get involved? How are a bunch of organizers involved in organizing in health in South Carolina? And like anybody, it's because we were asked, just like we will be asking others in South Carolina to join us. Somebody asked us to join them, and that somebody was the Fannie E. Ripple Foundation and the Rethink Health Initiative, which is funded also by the Fannie E. Ripple Foundation. It's a collaborative group of folks, an effort that began in 2007 of diverse leaders, thinkers, and doers who are now working together and have committed to at least a minimum of 10 years to work towards changing our nation's behaviors and systems in health. And the Rethink Health group has recruited people like Marshall and also others in different examples of where they've created change outside of the healthcare environment and thinking about how those examples could then be applied within the health and healthcare sector. So these include folks like Peter Senge, who focuses on taking system theory and translating that into organizational change. He's at the Society for Organizational Learning at MIT. Or Elinor Ostrom, who's the 2009 Nobel Prize winner in economics, who's focused on managing the commons and is now thinking about how to think about health and health resources as a common pool resource and what we have to learn about managing common design principles as we think about redesigning our health systems. So we're working alongside folks like Eleanor and Peter in thinking about how to change health around the triple aim across this country as a movement. And Organizing for Health specifically is focusing on the organizational aspects within our communities. All of us in the Rethink Health group share in common a focus on the triple aim, working across organizational boundaries, relying on systems thinking to drive new structures, practices, and policies, engaging individuals, all of us, in our own shared responsibility to achieve the triple aim, so what that means in our daily life as well as what that means in our organizational life. And then finally, working at the regional level to build a national vision through regional leadership efforts and examples from which we can draw. So as Rick indicated, the Organizing for Health group has selected 2 project sites to pilot our efforts. One is in Manchester, New Hampshire, and the state of New Hampshire. The other is in Columbia, South Carolina, and the state of South Carolina. And we chose these states because we're looking for a state of readiness, a place where, as organizers, we saw that there were folks who are already really committed, number one, to the triple aim, to collaborating with one another across organizations. So just this morning's announcement of the Partnership for Health is a great example of what you guys are already doing around partnering between payers and research and providers. And folks who have a commitment to learning, who want to try new things and to get to the solutions because the commitment to the solution is what drives you. So organizing itself is then equipping these constituencies, these diverse constituencies of our communities, families and patients, teachers and churches, providers, payers, and employers, with the power, which is it's a power that we have in the resources we have, not only in our organizations, but in our own lives, of the choices that we make and the stories that we tell and the strategy we take to get us to real measurable outcomes around the triple aim. So since Marshall did a really great job introducing the concept of organizing, and there's a little picture of Marshall, the methodology that we used was adopted by the Obama campaign in the election in 2007, 2008. So here's Marshall in New Hampshire, working through the various leadership skills that he described when he spoke to you. And again, the leadership definition that we use is what Marshall suggested. It's accepting responsibility to enable others to achieve purpose in the face of uncertainty. And so just to sort of walk us through, what does that really look like? We're pretty familiar in healthcare with the hierarchy model, which is can be a very efficient model. It can also, depending on which direction those arrows are going, if they're not going back and forth, if we don't have communication within the hierarchy, we may disable one another from achieving outcomes. I think the surgical checklist is a great example of that within ORs. We have what Marshall described as the diva model, so one person who's the star of the show, the captain of the ship, who takes on everything and doesn't let others help him or her, to the detriment both of that person's ability, but also of others disappearing because there's no role for them to actually work together to achieve any shared purpose. That's not the model that we're proposing. The we're all leaders model, the idea that all of us, we all have a great vision, and we do suggest that we build and develop leaders in everyone, but not so that we all go in our separate directions, so that we work collectively in interdependent leadership teams to achieve purpose together. and that you'll notice the arrows here going in both directions. And that's what we're striving for in organizing, is working, and we might have different roles on a team. You can imagine, for example, in an OR, we have different roles in the OR, but we work together to achieve the safety of the patient. So this is the idea of interdependent leadership, and we have examples of that. We have examples of that in quality improvement efforts. Again, McLeod Hospital and Dr. Michael Rose pioneered using the organizing model to not get folks to adopt the checklist from a compliance standpoint, where they're told to use it, but from a commitment standpoint, where they're sharing with one another on OR teams their call to health, their call to leadership in caring for patients, building relationships with one another and making mutual commitments to use the checklist based on those relationships. We can imagine this system based on the Partnership for Health among people who want to collaborate with one another across hospitals, insurers, and research to improve outcomes for people in the state of South Carolina. And we can imagine it in our communities, like Maureen showed us with the idea of walking bus or cooking classes and ways in which we can enable one another in our own families to be healthy. We can imagine it in South Carolina. We hope you can imagine it in South Carolina, and we're asking you and your vision team to imagine it and to work with us, and we hope we have something to offer in achieving it. So we're going to actually go into one of the 5 leadership skills with you. We're going to actually ask you to practice it together with us. And so I'm going to invite my colleague Terry Jowers, who's the lead organizer here in South Carolina and member of the Organizing for Health team, to introduce herself as well as the first leadership practice.
I am Terry Jowers, the lead organizer for Organizing for Health, and I'm from very rural Barnwell County, South Carolina, and I've grown up in a family of activists. During the Depression, my grandparents regularly brought home hobos and struggled to feed them along with their 10 children because they couldn't stand the thought of anybody going hungry. Each year, my father, Quimby, plants an enormous garden so he can help feed all the widow women in town. As my son, William, would say, I was raised to be an activist. I've worked in political campaigns, for nonprofit agencies, and as a victim advocate. In the 1990s, I helped organize a movement which led to a victims' rights amendment to the South Carolina Constitution. And it gave victims the right to have information and to get services they needed. Now, it seems like all my years of activism have led me to public health. At 82 years old, my father is still a very handsome man, and he's often mistaken for Andy Griffith. But 3 years ago, he was diagnosed with Alzheimer's. We don't live in a community that has a primary care center. So once a year, my family travels 100 miles to see a neurologist who simply writes a prescription for Aricept and makes an appointment for the next year. No guidance and no help with the anxiety and the depression that is debilitating my father. We can do better than this. Every community should have a cost-efficient medical home where patients not only receive great care, but the help and support they need to live a healthy life. Physicians should have access to electronic records on all patients. So my father isn't prescribed 2 Benadryl and a glass of wine by one physician and a Xanax at bedtime by another. In South Carolina, we have many visionary, innovative projects and initiatives going on. But we also have a system that is financially unsustainable with dwindling access. And we have public officials who don't seem to understand the cost of cutting health care. But I know the power of working with people, and I know that with a shared purpose, we can work together to change this. I'm energized by being a part of Organizing for Health and working with this wonderful leadership team. We all share in the problem, and we all can share in the change. By organizing communities, both medical and public. We can increase access to care, reduce cost, and improve the quality of life for everyone in South Carolina. In a moment, we're going to let you share what calls you to leadership in health. But first, we're going to talk about the organizing strategy. One of the strategies that we use in organizing is public narrative, telling a story. And public narrative is used to motivate others to join you in action. It's a leadership skill that translates our values into action. The psychologist Jerome Berner wrote that we interpret the world in two ways, the analytical and the narrative. The idea is that we engage our strategy, the how, and we use our hearts to tell a narrative, the why, in leading us to use our hands in action. Let's take an example. I shared with you about organizing to get an amendment passed to the South Carolina Constitution to include a Victims' Bill of Rights. But how did we do it? What was the strategy? We had solicitors doing press conferences. We organized victims and survivors and victim advocates and communities. We wrote letters. We rallied at the State House until we got a resolution on the 1996 ballot. That's the how. But what's the why? What motivated me to do that, to get involved? That would be Jennifer. Jennifer was beaten and raped and left in the woods badly injured by a man who drove a white Buick. And every time Jennifer saw a white Buick, she had an anxiety attack and ended up in an emergency room. She couldn't afford the treatment that she needed to get past this post-traumatic stress. So I organized for Jennifer and for all the victims of crime who deserve to have treatment. That is my motivation. In narrative, we use our heads and our hearts to motivate us to motivate others to join us in intentional action. So values inspire us on several different ways, but part of it is physiological, part is cognitive, and part is behavioral. So what happens when you watch someone run a 50-yard touchdown and score the winning touchdown for the game? You get excited, your heart races, you feel anxiety, you feel joy, you jump up and down, you scream, and you might curse if it was someone on the other team. It's what Kate calls the spine-tingling effect. When you hear something that elicits a physiological reaction from you, something that you feel deep inside. So when I shared my story about my father having Alzheimer's, perhaps you thought about somebody that you knew who had Alzheimer's. When I shared that the neurologist just wrote a prescription, you might have felt anger or pity. But why did you feel something? Because emotions are the way we experience our values. Emotions are the way we experience our values. Many of you are healers and you care for others. You have no doubt experienced that as a feeling, and it's motivated you to deeper action. So, in Kate's story, if she had just told you that she was lying in a bed of pain and she couldn't move and she couldn't do anything and she was paralyzed and she left it there, would it motivate you to action? Probably not. But in Kate's story, she felt you felt the urgency of the situation. She needed this medication. You felt anger at the injustice. This wasn't right. But you also felt the hope that she had, knowing that organizing, bringing people together with a common goal, could make a difference. That was her story of self. So through narrative, we are moving people by making hopeful, intentional choices. So that brings us to public narrative, the story of us, of self, us, and now. Self, why me? Why should I be involved in this? The story of us, what is our shared experience that makes us want to get involved with this? What is it that we need to change? And how can we work together to do that? And finally, the now. What is the nightmare that we face? And how can we overcome it? What is that hope that we have of seeing a better day? The choice that we can make to make it real. All right, now it's your turn. Now it's your turn for prophetic hope, as Marshall called it. We're going to let you turn to your neighbor and take a moment to answer a couple of questions. One, what called you to leadership in health? And imagine what achieving the triple aim looks like in your community. So what I'd like you to do is to get comfortable, relax a minute. We're going to do some creative visualization for a moment, and then we're going to turn to your partner and share. Everybody comfortable? All right, take a deep breath in. Breathe in hope. Exhale stress. Breathe in achievement. Exhale silos. Breathe in peace. Exhale discord. Okay, turn to your partner. We're going to give you 10 minutes to answer these questions. Imagine how you were called to leadership in health and the AAA.
We're not going to have time to be able to do a formal debriefing with all of you, but hopefully this will help continue further dialogue with each other and other people during the rest of the 2 days while we're together lunch and in between, and even in this evening when you come together for dinner. Hopefully you'll continue this discussion about how do we create healthy communities in a healthy South Carolina, and how do we actually bring the triple aim into reality for everybody in our state. It's very exciting about this partnership we have in trying to look at how we can apply organizing principles in healthcare and in health, and how do we create a true social movement. We are focusing initially in Columbia. The idea is you start one community at a time, and we have a partner or sister group up in Manchester that we're getting to know, and I'm really pleased to be part of a 6-member team that's looking in Columbia, and also has a member from Charleston as our kind of sister community, the next community we'll be working with here in South Carolina. We are kind of the core vision team, and we're definitely going to be following the Snowflake Matrix model for leadership, and we'll be asking many others, including those of you in the room, to take action with us, to become part of that leadership matrix, to really drive change in the community. And so what we're going to do now, before we wrap up, is I want to have give an opportunity for 4 of those members of the team to share their story and what's been their calling to work together to, again, make the triple aim happen for every person, every citizen, every constituent. So I'm going to first turn it over to Laura Long.
Thank you, Rick, and thank you for the privilege of being on this team and to talk to you today about my story. I'm a 60s kid. That makes me a hippie. Some of you can relate to that, a bit of a rebel, you know, sign, everywhere a sign, blocking out the scenery, breaking my mind. That's me. So I'm not afraid to challenge the system. You know, I'm not afraid to, I'm not accepting the status quo. So that works for me. I also grew up in the shadow of Kennedy, and the mantra of ask not what your country can do for you, but what you can do for your country. So duty is very strong in my family. My father also started with very little, and he had some demons, but he faced those demons through hard work and discipline, perseverance, and determination, and he became very successful. And he passed those values on to me. So hard work and determination I learned in spades. So the fact that change is hard does not frighten me. He also taught me the responsibility of gifts. That to those that, to whom much is given, much is expected. And I was given the gifts of excelling at academics. He didn't. He was grateful to get through college with a 2.0. He needed that to graduate. I think he had a 2.04. He has no idea where I got my brains, but I just happened to have that gift. But he said, you have that gift and you must give back. That was, again, that duty. That sense of duty was ingrained in us, and that you must give with that duty. I also grew up my elementary school years and junior high school years just outside Washington. So those of you that might remember the early 70s, the Vietnam War demonstrations. Nowadays we do demonstrations, it might be a 3-hour march, maybe a really big one might be all day. Well, they flat knew how to do demonstrations back in the 70s. They moved in. It was 3 days. They brought tents. They were naked. It was make love, not war back then. I was impressed. I was 12. It was very impressive, the power of organizing back then. So when they came to me and said, do you want to, figure out how to harness this power of organizing? I was like, yeah, I want that power on my side. So that has led me to where I am today. That I would like to figure out how can we organize, how can we harness that power of leadership and organizing to change things in South Carolina. It bothers me that so many of our children don't graduate from high school in South Carolina, that as many as a third of our kids are illiterate, that we don't get all of our kids immunized, that our second leading cause of death is colon cancer, and that most of that is preventable, and that as many as half of our people who are eligible for screening don't get screened. It just bothers me. And we heard today that as many as 20% of our admissions are related to medication errors, and that as many as 20% of Medicare folks get readmitted within 30 days because of systems issues. So as I say to myself every day, and as I say to you all, to those that much is given, much is expected.
Sean Stinson.
Hey there. I'll be very brief. I'm Sean Stinson. I'm the Vice President for Clinical Quality and Patient Safety at Palmetto Health. And I started in this to get interested in systems work when I was residency program director. I directed a residency program here in internal medicine for 11 years. And I have to tell you, working with the patients that we worked with, and I also had a busy, faculty practice as well, and worked in the hospital a lot, I became very frustrated, as I'm sure many of you are. And I'm very frustrated today as well, and kind of tired. I'm really tired of those slides that we see, that despite the best efforts of everybody in this room and all of our colleagues that are working inpatient, outpatient, throughout our state and throughout our country, that we hurt people. I'm tired of seeing that we're in last or almost last place among developed countries in our health outcomes. I'm really irritated that we're pitted against the people that we serve, our customers, our patients. They're not our customers, they're our patients. They're our partners. And that we end up with a lot of finger pointing. We all do it, right? We point at, right now we're pointing at Nikki Haley. She's pointing at us. By the way, you're all immoral. Sorry, that was the finger pointing that I'm not supposed to be doing. But just really, really tired of doing what we, each one of us thinks is the best thing to do. Imagine if we all walk out of here today and we all go back and we work on the surgical safety checklist. What great things will be accomplished. Fewer people will die. They will. but we're still going to be faced with the burden of chronic illness, right? I mean, all the things that we're going to be talking about today, we are going to allow people to leave the hospital healthier, but we're not going to do anything with that particular project, which I am completely behind, but we're not going to do anything with that project about reducing the burden of illness in our community. And it's going to take a big grassroots effort to really get people to work together. It's going to take a change in the payment system, right? I mean, if you happen to be an internist that owns a CT scanner or an MRI, if you're really rich, if you're in an MRI, and somebody comes in with back pain, you're going to do an MRI, whether they need it or not. Why? Because Laura will pay you. Finger pointing, Laura. Imagine though the system that could be developed where we could actually spend less money to do a better job. That system exists, by the way, and I'm not a socialist or a communist, but that system exists throughout the world in different places. We do a fantastic job at what we're reimbursed to do. So one of the things that I'm going to be really pushing for, along with my colleagues, is to help to change that part of the system where we're paid to help people be healthy and where the patients take part in it as a partner. So that was my last finger point, the Haley jab. That was the last one. If you ever hear me do it again, you're entitled to do a dope slap on the back of my head. But we need you. We need for you to go back to your communities. And we're going to be calling on a lot of you over the next few months to really start those snowflakes here in Columbia, but then across the state. And I look forward to working with each of you. Thank you.
Casey Fitch from Charleston, our partner from the Holy City.
The token Charlestonian in the group. I'm Casey Fitz. I'm a general surgeon from Charleston, South Carolina. After 10 years of being frustrated that I couldn't properly take care of my uninsured patients and screaming at the system to change, I finally decided to take a year off of my practice and helped to develop a community program in Charleston to take care of those that were uninsured in our community. Shortly after starting that program, a nurse that I worked with asked me to help her daughter who was having severe pelvic pain. She had worked all her life, but the small landscaping company she worked with stopped covering healthcare coverage. They couldn't afford it anymore. So she went 4 years without having any annual exams, was having horrific pelvic pain. She got into our program and we got her hooked up with a colleague of mine who unfortunately diagnosed her with advanced cervical cancer. The pain was from the cancer eroding into the side bone of her pelvis. Over the next 2 years, she underwent chemo and radiation therapy, multiple painful operations. She had mets into her liver, eroding into her chest wall. Just for pain control, after radiation couldn't do it, I had to resect part of her chest wall and her liver just to try to keep her comfortable. Unfortunately, she ultimately died. Man, I always don't get through this part too well. She lost her home. She'd lost all her savings. Parents, hardworking people in their 60s, a high school coach and a nurse lost most of their savings just taking care of her, even though all the physicians and we were all taking care of her for free. Melissa didn't die of some unknown incurable disease. Her family was not devastated emotionally and economically because of some unavoidable catastrophe. This was a system failure. Melissa was 32 years old. The thing that drives me are how many Melissas are in my community right now, teetering between a position now that they may have curable to the catastrophe that I just described. That's my drive. What's my optimism? Is that hopefully by utilizing these tools that we are being given through Organizing for Health, with the backbone structure that we've got in our state that is incredibly strong, from our South Carolina Partnership for Health to community programs around the state that are already bubbling up that are doing the same thing. we have an opportunity to absolutely lead the nation in healthcare reform, to turn all those statistics upside down, and I will be very, very proud to do that with y'all. Thank you.
And to close, before we head to lunch, is Dr. Stuart Hamilton.
Is it afternoon yet? It is afternoon. Good afternoon. My name is Stu Hamilton. I've been tasked to do 2 minutes. So let's see. I was born on Long Island in Brooklyn and raised as a child in the suburbs in the 1960s and late 50s and early 70s. Dad was a policeman, and that conferred upon me diplomatic immunity. I could do anything, anywhere, and I had backup to prove it. When the bullies would attack to my right, I could stand there. When they would attack to the left, I could stand there. And I was never attacked, never, ever. When certain groups would attack with BB guns, my dad would go and speak to them, and I'd never see them again. So I grew up with a sense of confidence, not quite being invulnerable, but a sense of confidence. And it's continued throughout my life. A couple of years ago, I went to my office. I do pediatrics, and it was late at night. Why was I there? It was not a wise decision. I parked my car where it was in the light, and I came out of the building about 11:30 at night, and sure enough, someone jumped from behind the car. He came up to me, put his hand in his pocket, and I was not going to allow myself to panic. I put my hand in my pocket on my cell phone, and as he stood directly in front of me, about 3 feet away, I said, "Okay, who's going to make the first move?" And he backed down and walked away. I cannot explain it. I cannot explain it. I have been a community organizer since my first year in college. When I went to college, there were 7 black people there. I said, 7. 2 were certifiably insane. They had snapped under the stress. So that left 5 people to take over the school. And how did we do it? We were the second college in the United States of America to be taken over by the student body. It was organizing. We organized 350 people from the Students for a Democratic Society, the ill-famed SDS, and the 5 black people. And we took the buildings for as long as we could, which was 3.5 days because we had no food or water. So, continuing from there, I was a student of Martin Luther King's speeches and of Billy Graham on the radio, and decided to accept the call. I decided to accept the call of the gospel and to lay down my life in service for other folks, after I had given up my ambition of becoming a fighter pilot, which was my lifelong dream, and it took a little while for that to die. So it was flapping around on the floor, and I decided to turn and go in another direction. Moved to South Carolina, put together a 30-physician group to do poor people, and we do currently 1/3 of all the people in poverty in Richland and Lexington County in our group, with 1% local financial help. So, what can Organizing for Health do? Organizing for Health can bring that 1% up to a bazillion percent, and we in Columbia can create the true beloved community and be a city on a hill where we can dispense the kind of care that people only dream about. And we can be a light in the present darkness and do what we are all called to do, because it is not too expensive, it is not too complicated, and it is not too difficult. We simply have to want to do it, decide to do it, and move forward together and do it. Thank you.